Trump's Medicaid cuts. Parents call it a death warrant for sick kids. When President Donald Trump signed his sweeping One Big Beautiful Bill Act, many parents of chronically ill children said they felt like the government had just issued their kids a death warrant. The legislation, which slashes nearly $1 trillion in Medicaid spending over the next decade, has left families in rural America fearful of losing access to life-saving treatments. A mother's daily fight for survival. 28-year-old Hannah McDaniel, the mother of a toddler born with a rare congenital heart defect, every day is a battle, not just for her son's life, but against the bureaucracy that controls his access to care. Her 2-year-old son, Miles, was born with hypoplastic left heart syndrome, a condition where the left side of the heart is severely underdeveloped. Miles has already endured 2 open-heart surgeries, one at just 4 days old and another at 5 months. He is awaiting a 3rd surgery that could extend his life, though it will not cure him. Hannah knows that any delay, denial, or paperwork error could be catastrophic. It's all day, every day, and it's exhausting when you already have this mental load, Hannah explained. She works full-time, cares for her stepson, travels 5 hours to New Orleans for Miles's treatments, and manages endless stacks of Medicaid forms. When Trump's bill passed in early July, Hannah said she cried. The day that bill was signed, I felt like the government had signed Miles' death warrant, she said. The ripple effect in rural America. Miles's story is not unique. Across the country, rural families are bracing for devastating consequences from Medicaid cuts. Unlike urban areas, rural regions often lack advanced hospitals and specialists, forcing parents to drive hours for care. Medicaid helps cover travel, treatment, and essential therapies. Without it, doctors warn children's hospitals and pediatric practices will close their doors. Any cuts to that program are going to trickle down and impact children, said Dr. Lisa Costello, a pediatrician in West Virginia. It's going to hit pediatric practices and children's hospitals hard. The Congressional Budget Office estimates that 10 million people could lose coverage by 2034 as a result of the bill. While the White House insists Medicaid is not being cut, the numbers and frontline doctors say otherwise. Dr. Wendy Johnson, a family physician in rural New Mexico, fears this is the final nail in the coffin for struggling rural hospitals. We're in a downward spiral, she warned. This bill could crush what little system we have left. Medicaid coverage yanked away. Hannah has already experienced what it's like when the safety net disappears. Last year, Miles briefly lost Medicaid and disability benefits due to a clerical error tied to her modest pay raise of just $10 an hour. The Social Security Administration informed her that Miles was never supposed to receive disability benefits, and reduced his monthly support to $90, an amount that doesn't begin to cover his medical needs. I went straight to the Social Security office. They told me his benefits were revoked due to income changes, but no one had ever notified me, Hannah said. Desperate, she called every local and state official she could find. You've got to fight doctors, the healthcare providers, the state government, the federal government. I knew I had to make it work because Miles is due for surgery, and if he doesn't get it, he will die. After weeks of advocacy, Miles's Medicaid was reinstated. But the family is still being chased for $5,000 in alleged overpayments, and his disability benefit has not been restored. Hannah now relies on GoFundMe campaigns to cover trips to New Orleans and unpaid household bills. Families across the country share the same fear. In Oregon, Marissa Butler is fighting for her daughter Lavender, a toddler with ataxia telangiectasia, a rare neurodegenerative disorder that damages the nervous and immune systems. Lavender requires weekly antibody infusions costing more than $40,000 a month. Medicaid is the only reason the family can afford it. My daughter is going to need more and more care, Marissa said. Without Medicaid, I don't know how we would take care of her. We already have a million barriers in our way. Like Hannah, Marissa must constantly reprove her daughter's eligibility. We just have to keep proving that we deserve to be on Medicaid, she said, frustrated. In Iowa, Natalie Oyenstoyer recalls how Medicaid saved her family when her son Sage was diagnosed with a rare childhood cancer, rhabdomyosarcoma, at age 3. Now 7 and in remission, Sage still requires ongoing monitoring. Natalie fears what will happen if paperwork mistakes or new requirements strip his coverage. It makes me think of my son as he gets older. What if he can't keep up with the paperwork? Natalie asked. Having cancer at 3 should be enough of an excuse, but I don't know what to expect. It's suffocating. Red tape is a weapon. Under Trump's bill, families on Medicaid must recertify their eligibility every 6 months instead of once a year. Able-bodied adults will also be required to complete at least 80 hours of community engagement per month, work, volunteering, or school, to stay enrolled. While exemptions exist for the sick and disabled, advocates say proving those exemptions is a nightmare. This will kick millions off Medicaid, explained Larry Levitt of KFF, a health policy research group. Not because they're unqualified but because they fail to navigate the paperwork. That red tape becomes the weapon. The consequences are real. In 2018, Arkansas implemented work requirements, and 18,000 people lost Medicaid coverage almost immediately. Many couldn't prove their hours due to complicated reporting systems, leaving them without access to critical medications. Bethany Lilly, policy director at Blood Cancer United, warned, even a short delay in cancer treatment can mean life or death. For rural families, these new rules could be devastating. Parents left in fear and exhaustion. Across Louisiana, Oregon, Iowa, and beyond, parents echo the same message. They are drowning in red tape while fighting to keep their children alive. For Hannah, the stress is constant. I am a medical mother whose child's life depends on Medicaid, she said. And I am drowning trying to fight my way through a broken system to keep him alive. Marissa echoed the same exhaustion. We already have so many barriers. Now they're adding more. I just feel uncertain all the time. Natalie summed it up in one word: suffocating. Conclusion: a growing divide. The Trump administration insists the bill expands rural hospital protections and increases state flexibility. But for families on the ground, the reality feels very different. To them, this legislation is not about reforming Medicaid, it's about making it harder for the most vulnerable to access care. Doctors warn of closures, parents fear losing their lifelines, and children's futures hang in the balance. Whether in Louisiana, Oregon, or Iowa, families say the same thing. Medicaid is not just an insurance program. It is the thin thread keeping their children alive. Thank you for watching. Please like, comment, and subscribe.